Hello everyone, welcome back. Do you have a child with cystic fibrosis? In this video, there are 12 tips that can help your child live a longer and healthier life. At number 1 is screening is the key. If your baby tests positive at newborn cystic fibrosis screening, then expect additional tests to determine whether they actually has the condition. About 90% of the newborn who screen positive are carriers and don't actually have the condition. Bringing your child in for follow-up visiting will help doctors begin to plan his or her care. Number 2, frequent visits improve outcomes. Children who see their doctors frequently have better growth and lung function and live longer. The standard of care is quarterly visits, but because research shows more frequent visits improve outcome, so follow-up visits should be every 2 months. Number 3. Make a habit of airway clearance therapy at least 1 session per day. To make it a little easier for your child, schedule your therapy session to coincide with your child's favorite TV show, so they can watch it while receiving the treatment. And also develop a ritual where you read a favorite book, play a favorite game, or enjoy another special treat after each session. Another important tip: ward off infectious germs. Children with cystic fibrosis are at high risk of lung infections. So, keep your child and other household members up to date on vaccination, including the flu shot. Encourage your child and other household members to wash their hands with soap and water before eating and after coughing, sneezing, or blowing their nose. Teach your child and other household members to avoid sharing personal items such as water bottles. Clean and disinfect medical equipment. And if another member of your household gets sick, ask them to stay at a distance from the child with cystic fibrosis. Number 5. Keep your child away from the tobacco smoke. Do not smoke or let anyone else smoke around your child or in your house. Number 6. Foods that your child should eat. Now he or she can eat the type of foods that other kids can eat, though there are a few things which need to be added to their diet. These include more fat and calories. Children with cystic fibrosis need about 2000 to 2800 calories per day. One way to help your child take in more fat and calories is to offer whole milk at every meal. You can also add whole milk dairy products to the food they eat. For example, use cream on cereals. Add butter to most meals. Put extra cheese in casseroles and other foods. Also consider some special foods on hand, for example, granola with nuts, trail mix, nut butter, protein bars, and nutritional supplement beverages. Now another important thing is vitamins. Cystic fibrosis affects the body's ability to absorb vitamins. Children who have it need to take vitamin supplements to make sure they get enough. Now work with your child's cystic fibrosis care team to find the right vitamin supplements and doses for your child. Next thing is enzymes. Your child will probably have to take these before they eat. You can open the enzyme capsules and mix them into foods like applesauce. You should always do it right before your child eats, not ahead of time. Number 7. Encourage your child to play and exercise. Children with cystic fibrosis feel tired easily or often be short of breath, but most can do any type of activity they want. Now many can actually benefit from it. Exercise helps loosen mucus in the lungs. It strengthens the muscles that help your child breathe. It can also boost their confidence and self-esteem. Be sure to speak with your child's cystic fibrosis care team before they start any new type of exercise. Number 8. Keep your child well hydrated. Children with cystic fibrosis lose more salt when they sweat. If your child loses too much salt, they can become dehydrated. So encourage them to drink more fluids more often while playing. Next is work with your child's school. Communicate with your child's school to develop a plan to accommodate their health needs. For example, you might ask the school to give them time and privacy to perform airway clearance therapy, to let them take medication, adjust attendance rules to let them go to the medical appointments, and provide extension and help them catch up on lessons and assignments they miss due to the medical appointments or illness. Another important tip: involve your child in their care. You can start early by teaching your child basic information about their condition, how to talk to other people about it, and simple strategies for staying safe, such as hand washing. By the time they are 10 years old, many children can set up their own therapeutic equipment. And by the time they hit high school, many are mature enough to take primary responsibility for storing, carrying and taking medications, as well as disinfecting their equipment. Next important thing is genetic tests may play a role. For a growing number of those with cystic fibrosis, medication that target the genetic mutations can completely relieve the symptoms in a matter of weeks. Early treatment with some of these medications can completely change the way the disease progresses. So you will want to work with a team that is aware of and perform genetic testing. And an important advice: show yourself some love. To avoid burnout, it is important to practice healthy habits and take time out for yourself. Try to get 7 to 9 hours of sleep per night. Eat a well-balanced diet and exercise regularly. Schedule time in your calendar to socialize with loved ones and take part in activities you enjoy. Okay friends, thanks for watching. Please like, share, comment and subscribe to my YouTube channel for more informative health videos.